Welcome back. It's 6:33. You're inside What's on My Mind here on Nationwide this morning, Nationwide 90 FM and Nationwide Radio JM.com. It's the big show. I'm Kalila Reynolds. I've got always seemed so amused when I say that for some reason.
Hello to our listeners. I am Abka Fitz Henley.
How are you doing this morning, Abka?
I am doing well. How are you?
I'm not bad myself.
Let me say hello to all our listeners. Sometimes we come here and we say special morning to the people on the front line, including the doctors, nurses, etc. But there is also people who perhaps are support staff in this bid to limit the spread of the coronavirus, including the law enforcement officers, the policemen and women who are away from their families at odd hours seeking to enforce the curfew and the implementation of the Disaster Risk Management Act. Good morning to you. We appreciate your service to your country. Kalila, what's on your mind?
Quite a few things are on my mind today, actually, and they all have to do with the times that we are in, the coronavirus and the response and the things that we are doing because of it, some of the things that we're forced to do because of it. I want to start with a couple of comments on education. I'm pleased that there's some guidance where we're going with the education system for the next few months. Recall that I would have brought this issue up sometime last week about what are we going to do with the next school year, how we're going to handle assessments for moving up to the next grade level. And I heard Minister Carl Samuda, Education Minister Carl Samuda, addressing that at the press conference last evening. So physical school is off for the rest of the school year, as we had anticipated would have been likely, but they finally come out and said that as policy. So physical school is to reopen in September. And I had raised those concerns about determining promotion. How do you go about assessing your students? And he clarified in the press conference last evening.
Examinations that usually at this time of the year determines the placement of students from grade 6 to high school grade 7. We will use, instead of the PEP,
Turn up the speaker, please.
we will use aspects of it to determine how to place the children. We will use grade 4 numeracy and literacy exams done in 2018. Grade 5 performance task, which comprises maths, English, arts, social studies, and sciences, which was done in 2019. We will, in addition, use the results of the grade 6 ability test done in February 2020.
So there you have some clarification from Minister Samuda about how they are going to decide who moves up to the next grade level. It's not a perfect system, ABCA, as one would imagine. It's not an ideal situation, but we're not living in an ideal situation. We're living in an extraordinary time, and so measures have to be taken that would reflect that reality. So I'm grateful for that clarification. On the matter of businesses and the economy.
Before you go on to that, I see a suggestion online that perhaps we should aim for using the results as a cardinal cease with it. Say 18 to February 2020 classwork and test grades to determine who gets what place in schools in terms of PEP, as opposed to what the minister proposed.
Okay.
I don't know how feasible that is at all. Anyhow, you were saying.
Okay. Well, I'm not in the position where I have a school age child in those grade levels right now. My older daughter is anticipating CAPE exams, and that decision has yet to be made. So we're looking out for that announcement. For the parents, though, I know there's been a lot of concern about what is happening with the education system, whether the children, and I'm sure the vast majority of children have been falling behind because it's hard for parents to try to manage homeschooling. If you yourself are working from home, trying to do work from home while simultaneously schooling children at home is difficult. And if you're not working from home, then the children are mostly unsupervised at home. And that's another challenge because you still have to go to work. So either way you take it, it's a difficult
Yeah,
situation.
and a point made by the minister yesterday is that over 30,000, by the ministry's estimation, of the children do not have access to online
And then that's
learning.
another
So
matter.
that increases the challenge. But such is the nature of the times.
Right, I hear them saying that they've procured additional tablets for students,
Mhm.
especially for those in need, and they're going to be distributing those soon. They can't come soon enough. I mean, we've already gone, what, 2 months now of this homeschooling. School closed on March 10. We're approaching May 10, so it really can't come soon enough. On the matter of businesses now, I hear the cries of the business owners. Some of them revenues down, sales down 50% over the past few weeks. Many have already laid off workers, others are contemplating doing so. Even the mighty KFC, and I've seen a lot of comments about that. And I hear the cries as well of regular people who no longer have a job. And I note the efforts of the government and the desire to start reopening sections of the economy that had come to a halt or have come to a halt
Mhm.
or have at least seen significant declines. And of course, I get it. You know, if you are suffering, if you have lost your income, if you have to be faced with the hard decision to look people in the eye and tell them you no longer have a job, that's tough. That's a hard pill to swallow. But I still worry that we may be doing some of this too early because I feel like the virus hasn't yet hit its peak in Jamaica. And we continue to report new numbers, sometimes dozens at a time. Although I am heartened that in yesterday's press briefing, there were only 2 new positive cases. I think that's the first time I've heard a single digit increase in some time, and I hope that trend continues and it's not just an anomaly because that would provide some comfort as to where we are on the curve.
What I didn't get from yesterday's media conference, and perhaps I missed it and it was said, is how many tests were conducted over that 24-hour period to give us an idea of how to receive the tool.
Okay.
But in the prior days, we've had over 500 people being tested, sometimes 600, sometimes 400. So I know there has been a drastic increase generally of the testing on a 24-hour basis. But what I didn't get yesterday is
They didn't
how
mention
many
it?
was tested. I'm not saying they did not. I didn't hear it.
Okay. I, I,
And
I
I
don't
did
know
miss some
either.
of the media conference.
Yeah, I didn't listen to the entire thing myself. But I did pick up that there were only 2 new cases. But that's a good point, Abka. 2 out of how many
Mhm.
would be important to know in order to say whether this is an exceptionally good result or not. But on the point that I worry we may be doing some of the reopening too early, you might say that, well, I can sit here and say that because I still have a job. Obviously, I'm still here on the radio talking to you. You might say that, well, my income hasn't been affected. And so anybody who's not feeling it, who's not suffering, can chat all they want, right? But I fall on the side of I have a healthcare worker in my home. I have people who are in the senior citizen class in my home daily, and I worry more about their health and safety than I do about my own personal income, even if it was to come to that. Because for them, this could be a life or death situation. And I interviewed the chairman of Wasinko Group last evening on Taking Stock, William Mafood. And he's in an interesting situation as well because he's a major business leader, former president of the private sector organization. But he also has a healthcare worker in his family. His daughter is a doctor in Connecticut. This is what he told me last evening.
Been challenging. I had one daughter who had
I won't
the
take the
virus
second
in,
one.
She was in New York.
Really?
I have another daughter who she's a doctor at the Hartford Hospital in Connecticut. She's actually working in ICU for the last 5 weeks. So she's been, one of those doctors who have to intubate the patients and put them into comas and then monitor them and so forth. So she's seen a lot of hardship and challenge. Like
That must
as a
be
doctor.
scary to have a child who is in the medical profession at this time. In where did you say she was? Connecticut?
She's in Hartford, yeah. You know, she was very nervous at first, and I spoke to her, said, listen, you know, in every sphere of life, if you're going to go through challenges and times, and I said, just face it with the reality that this is what you're destined to do and what you've been called for.
So that's William Mafood, the chairman of Wysinco Group. Wysinco happens to also be in St. Catherine, which is like ground zero right now in Jamaica, the epicenter of the last outbreak of the virus there in Portmore. Wysinco is St. Catherine, near to Portmore, not quite Portmore. And then he also, on the other hand, so he's responsible for hundreds of people's employment, and on the other hand, has personal experience because of his daughter being in the medical profession in the United States tri-state area, which has been very hard hit. And so you listen to people like this speak and try to say, how do we strike this balance between saving the economy and saving people's lives? And it's such a delicate line that we have to walk. And I say all of this to come to the point that I think what we need to be doing right now, Abka, if we want to really stand a chance in where we're going with the economy and still feeling somewhat safe that we can safely reopen and safely do that, where we need to be heading right now is to start random testing. Because like you pointed out, you're not sure how many people were tested in the last batch over the past 24 hours. We now have the equipment that we can test a vast amount more people at once within a 24-hour period. I think we will be put much more at ease if the Ministry of Health, if the health authorities start randomly testing people, taking a sample of the population from different parts of the island and start random testing. And that way, we will get a better sense of where cases are concentrated, because right now, we're only testing for the most part those who present with symptoms and those who have come in contact with a known case. But there may be cases elsewhere in the island that we aren't tracing, that we aren't tracking. And so I think random testing is a way that will help to account for those cases that we aren't currently aware of. I personally think that we have way more than 400 and odd cases that have been officially confirmed.
Yeah, no doubt at all. And just to clarify, what was said at the media conference yesterday is that in the past 48 hours, 615 samples were tested. And so far in Jamaica, 5,830 people have been tested for the coronavirus. 471 have come back positive, which means 5,320 are negative.
Okay. Thanks for that update. So, but what I think with the random testing is that it will give us a better sense of where the true pockets are in Jamaica, and it will also let us know what percentage of the population likely has it. If we are to do sampling of the population, we can say, okay, well, 10% of the population has it, 5% of the population has it, when you extrapolate the numbers. And we'll be able to identify where are the places that need the most urgent interventions and the most stringent measures. So I think that that's a suggestion that perhaps the authorities ought to consider, that we move towards random testing and not just those who present with symptoms or who've come into contact with a confirmed case. And that will help us with our decision making in where we go with reopening those sections of the economy that have been hardest hit. That's what's on my mind.